In the past 20 years, the pharmaceutical industry in the United States has paid out almost $20 billion to settle 165 cases in which the government alleges they have violated various laws, criminal laws and civil laws. The kinds of violations fall into two main categories. One, illegal promotion of drugs for purposes for which the Food and Drug Administration didn't approve the drugs. This can be very dangerous because people may get prescribed drugs because the company pushed them for a certain disease that have benefits that are outweighed by the risks, and therefore these are criminal violations in a number of cases. The other major category are civil violations of what is called the False Claims Act. In this case, companies are deliberately overcharging the government under programs such as Medicare and Medicaid, and basically causing the government to have to expend much more money than they would have because of these overcharges. In the last category, the False Claims Act, it's interesting to note that this law was passed in 1863 because even back then the defense industry contractors were cheating the government, so they passed the False Claims Act. And for most of the time between 1863 and now, the main industry violating this law was the defense industry. Starting several years ago, in terms of the penalties paid to the federal government for violating the False Claims Act, the defense industry has now been overtaken by the pharmaceutical industry. In fact, as of the last couple years, the pharmaceutical industry has paid more penalties under this False Claims Act, making false claims to the federal government, than any other industry in the country. Why is this going on? Our view is that in a time when very few new important drugs are being approved, the pharmaceutical industry needs to do something to sort of keep its sales up. And so it's engaging in activities according to the government, and it's paying out penalties for these violations that the government has charged to sell more drugs by charging more money, or to sell more drugs by making it appear as though the drugs work for more diseases than they do. This kind of activity is really unacceptable, and we are pleased to see that the government, particularly in the last 5 years, is going after them. 3/4 of all these penalties that were paid out and 3/4 of these violations that were alleged by the government have occurred just in the last 5 years. In other words, of 20 years worth of violations, 3/4 of them are in the last 5 years.